Hi everyone, this is Tim, your Block 2 instructor, and I decided to actually make a PowerPoint on cardiac medications to make it a little bit easier for you to study. So again, this is kind of a down and dirty way of being able to study the basics and things that are important and things you should know about cardiac medications and your antiplatelet drugs and your anticoagulants. So here we go. So the first one is Lasix. This is a loop diuretic, or also known as a water pill. It prevents the body from absorbing too much salt, and it treats fluid retention, high blood pressure, congestive heart failure, and liver disease. So side effects could be ringing in the ears, dark urine based on dehydration, clay-colored stools based on affecting the liver, low potassium because obviously you're going to flush out the system, and this could also be a side effect. It could lower calcium. It can also cause the patient to be weak and cause shallow breathing. Serious side effects are diarrhea, constipation, stomach pain, dizziness from the lack of fluid, spitting sensation, which is really kind of, that lightheadedness, and itching or a rash just based on being allergic to it. Kind of remember, for every medication that you ever learn, your patient doesn't necessarily know that they're allergic to it until they actually receive it for the first time. So I've never really had a patient who is allergic to Lasix, but it doesn't mean that it never happens. Aldactone is a potassium-sparing diuretic, so the patient will lose salt, but they actually keep their potassium. It's used to treat too much aldosterone in the system. Aldosterone is a hormone produced by the adrenal glands that regulates salt and water. The side effects are numbness and tingling, muscle pain and weakness, slow or fast heart rate based on either dehydration and their heart is trying to compensate for it. It can also make your patient drowsy, restless, or lightheaded. It can cause tremors, confusion, urinating less, dark urine based on making them dehydrated, or clay-colored stools, again, just based on infecting the liver. Everything else is pretty much similar to the side effects like Lasix. Alright, so for cardiac medications, you have Lisinopril, which is an ACE inhibitor. It relaxes the blood vessels, which lowers the blood pressure. It helps prevent strokes, heart attacks, and kidney problems. Side effects include lightheaded, dizziness, tiredness, a dry cough, which I find that most patients who are on this medication complain of. It also can cause fainting, muscle weakness, slow or irregular heartbeat, and vomiting, diarrhea. So the side effects kind of make sense. If you're taking a blood pressure medication that is either too high or your body's not really used to it, it will lower your blood pressure or drop it and cause the lightheadedness and the dizziness. Tiredness is also a side effect based on the fact that if your heart's not pumping out the blood very well, then it's not getting enough oxygen, blood, and nutrients to the rest of the body, which makes you tired. Let's see here. It also may increase potassium levels. And every website that I went to looking up this medication had specifically said do not take during pregnancy. This next medication is Metoprolol. It's a beta blocker. It treats high blood pressure. It treats severe chest pain such as angina. It treats heart failure. It will make the heart beat slower and lowers the blood pressure. Side effects are about the same as any other blood pressure medication. Symptoms of overdose is blue color in the fingers, lips, and skin. Obviously, if it's lowering the blood pressure that much, it's going to cause the extremities to not have enough blood supply. It also could be a loss of consciousness or a change in consciousness or no blood pressure or pulse. So again, if you take too much blood pressure, it probably will kill you, and that's a side effect. Cardizem is the next blood pressure medication. It's a calcium channel blocker. It relaxes the muscles of the heart and blood vessels. It's treats hypertension. It treats chronic angina and coronary artery spasms. Again, angina is basically a spasm of the coronary arteries, and this will actually help with that. You should not use this if the patient has sixth sinus syndrome, which I do not expect you to know what that is, but it is a disease process, or an AV block, unless the patient has a pacemaker. So the AV block is part of the cardiac conduction system, and if the patient has a pacemaker, they can actually take this medication. Do not take if the patient has kidney disease, liver disease, congestive heart failure, and if they're taking digoxin or a beta blocker. Do not drink or eat grapefruit, alcohol, or St. John's worts. This is a very big teaching moment for you to give to your patient, especially with the grapefruit. Other side effects are similar to other blood pressure medications. Digoxin is used to treat heart failure. It will also treat irregular heartbeats such as AFib. It improves the strength of the heart, so it helps with the contractility, maintains a normal, steady, and strong heartbeat. It decreases the risk for blood clots by reducing the risk of heart attack or strokes. Basically, if you give this, as I mentioned before in the other PowerPoint, AFib is where your atria is quivering instead of actually contracting and pushing blood out. So as that quivers and starts to churn that blood, it will cause blood clots. With digoxin, it actually causes the heart to contract better, and because of that, it actually reduces the risk for blood clots. It may not be absorbed well if the patient is on a high fiber diet or takes a lot of antacids. It affects sodium and potassium levels. Also, digoxin dosage is based on medical condition, the age, body weight, and lab tests, and the response to them actually taking it. Low potassium and low magnesium diets may increase digoxin toxicity. Kidney disease may also increase digoxin level. Digoxin level, the normal range is 0.8 to 2.0. And the digoxin toxicity will cause confusion, irregular pulse, loss of appetite, nausea, vomiting, diarrhea, palpitations, and vision changes such as blurred spots, blurred vision, seeing spots, color changes, and yellow halos. The next medication is nitroglyceride, also known as nitro. It usually comes in sublingual tablets. It treats episodes of angina. It's a vasodilator, so it relaxes blood vessels. It can be taken every 5 minutes for 3 doses. After that, it's obviously not going to work, and the patient should definitely be calling an EMS. Advise them not to drive themselves to the hospital, as if it does start to kick in, it will definitely lower the blood pressure enough that they'll get lightheaded and dizzy. Side effects are flushing, and also you should teach your patient to keep medication in the original container, which is usually a dark amber bottle that fits into their pocket, and it's good for about 6 months, which is very important, because if your patient doesn't ever take this, they could be carrying it around for years, and after about 6 months it's no longer as active, and you want them to be able to have the freshest medication as they possibly can, because when they really do need it, if it's not effective, then it's not going to work. The next medication is an antiplatelet drugs. This will be aspirin and Plavix. This decreases platelet aggregation and inhibits thrombus formation. It prevents heart attacks, strokes, and chest pain, also known as angina, and it also will prevent clots. Do not take if, or the patient should not take it if they actually have a bleeding disorder, stomach or intestinal bleeding, or liver disease. Anticoagulants. This could be heparin. This is the prevention of blood clots or existing blood clots. The lab that will be done is a PTT. That lab value is a 1.5 to 2.5. Coumadin, it will prevent or take care of blood clots. It will prevent blood clots caused by AFib or valve replacement. That lab is a INR, which will be 2.0 to 3.0, or based on the severity of your patient's conditions, could be 2.5 to 3.5. Levodox is also a prevention of blood clots or existing blood clots. That usually we give in the hospital for those patients who are usually walkie-talkies but are kind of stuck in bed for whatever reason. Anticoagulants, sometimes known as blood thinners, are drugs that are given to prevent your blood from clotting or prevent existing clots from getting larger. It inhibits the production of thromboxane, and it competes with vitamin K, which vitamin K can be an antidote. So your liver produces vitamin K, which is a natural reaction for you to form blood clots based on cuts and scratches and stuff. But if you take blood thinner, such as Coumadin, it actually competes with blood vitamin K to prevent that from actually happening. The lab value again is the INR, and this can be done weekly or monthly as a lab draw based on the patient, how they react to it, and whether or not it is making their blood too thin or too thick. So I've had some patients that get weekly blood draws because they have to be adjusted weekly, and if they can control the blood thinning or fit into that 2.0 to 3.0 or 2.5 to 3.5, then they only have to do it monthly. So when the patient should notify the physician. So when the physician's when the patient's urine turns red or dark brown, obviously it's too thin and they're bleeding internally. The stools turn red or dark brown or black, again it's internal bleeding. The patient may bleed more than normal when they, especially for females, when they have their period, and their gums may bleed. Again, the Coumadin or any blood thinner is really keeping their body from clotting. So when they take this medication, obviously anything that's going to cause them to bleed anywhere in the body or even internally, this will affect them. So the patient should or can have a bad headache or stomach pain that doesn't go away, and that's due to bleeding. They can get sick or feel weak, faint, or dizzy. If they think they're pregnant, they should obviously not take this medication. And the patient will also find bruises and blood blisters in several areas, especially for those who kind of bump things easily or bruise. If the patient has any accident of any kind, they should notify their physician just in case they're having internal bleeding. So for precautions, the patient should wear a medical alert bracelet. They should inform their dentist prior to dental work, which the dentist will probably take them off of the medication or lower the dose, or call their family physician to find out what the plan is. The patient should avoid sports. They should not shave with an actual razor. They should use an electric razor. They should use a soft toothbrush to make sure that their gums don't bleed. They want to prevent bumping into things. I think for the most part we don't do that on a normal basis, but when you're told not to, then I think that people tend to accidentally do this. So they should also stick to a Coumadin diet. This is going to, they're going to not eat green leafy vegetables because of the fact that it has a lot of vitamin K in it. And with the vitamin K, it will allow their Coumadin level to go too high, and they'll be too, it won't be as effective. And they should also wear sunscreen because the sun will actually make their Coumadin work more efficiently and it'll make their blood thinner, which will throw off their INR, and then they have to adjust all the medication. So for TPA, this is tissue plasminogen activator. It's given through an IV in the arm, and it works by dissolving the clot or improving blood flow. It's also known as the clot buster. This will not be given to patients who have had a recent head injury, bleeding problems, bleeding ulcers, pregnancies, recent surgeries, or taking blood thinning medications such as Coumadin. They will also not be given this if they've had some sort of trauma or uncontrolled severe high blood pressure. The blood pressure, if it's too high, can cause strokes, especially hemorrhagic strokes, and by giving TPA makes it thin and they just completely bleed. And I think that's it. So 13 minutes worth of down and dirty medications for the cardiac system. If you have any questions, let me know.